So what is normal hormone level for a woman that is still having natural hormones? That is a great question. And what's interesting is that women's hormones, especially estrogen, they go through ups and downs throughout the cycle. So it's very important when you test and what are you looking for. If you are on birth control pill, you shouldn't test your hormones. Your estrogen is going to be low. If you're not using any hormones, then your estrogen level is different from the follicular phase, which is the first 14 days of the cycle, versus the luteal phase, which is the second 14 days of your cycle. The 14 days, that day where theoretically many women will actually ovulate if they have a perfect 28-day cycle. So the interesting thing about the hormone levels is that the estrogen could be normal between somewhere between 50 and 300 in the follicular phase. So how do you know what's good? There are women who have 100, and that's probably normal for the 40s, but there are women who are 250 or 300 in their 20s. And that might be a little bit too high if they're not making enough progesterone. So everything has to be taken in context, has to be looked at based on woman's age, based on her circumstances, and definitely follow up with the luteal phase testing to see if we are having a good balance between the estrogen and progesterone. The point that I'm trying to make is that estrogen can go through ups and downs, and what's normal for a 20-year-old might be different from a 30-year-old, and might be very different for a 40 and a 50-year-old. So in my opinion, women should really test their hormones at least once a decade between the ages of 20, 30, and starting at 40, they should test them at least every 5 years, if not annually, because there's a large variety and many changes. And if you don't ever test your hormones when you feel good in your 20s, then how do you know what is your baseline? What is your good zone? What is unique to you and good for you? You have no idea. Most women test their hormones when their hormones are already messed up. They're either too high or too low. They have signs and symptoms. Well, we test the hormones at that point. We're going to be like, oh, well, it's normal. It's in range. And then you feel horrible. So then you have to also go see a doctor who understands your hormone levels and will take them in context.